Knee pain can sneak up on you. At first, it's just a little stiffness when you get out of bed, then a tug of pain when you stand from a chair, and before you know it, you're planning your whole day around how many steps you can handle. If you're over 60, you might have been told, "That's just age," or "You'll probably need surgery someday." But that's not the full story. In many cases, the right gentle, consistent exercises can help your knees feel stronger, more stable, and less painful, without pounding, jumping, or complicated equipment. Do your knees ache when you stand up, walk, or climb stairs, and you're worried it will keep getting worse over time? Stay with me, because in this video, I'm going to walk you through simple, safe knee exercises you can do at home to support your joints, reduce stiffness, and build the strength that protects your knees as you age. Welcome to Senior Health Secret, the channel dedicated to helping adults 55 and older stay strong, independent, and confident with practical, doctor-guided health advice. My name is Dr. David Kaplowitz, MD, and I've spent many years working with seniors who were convinced their knee pain meant the end of walking comfortably, climbing stairs, or enjoying simple daily activities. I've seen people who thought they were too old for improvement make quiet, steady progress and reclaim a surprising amount of comfort and control. If you are living with knee pain right now, I want you to hear this clearly. You are not weak and you are not broken. Pain does not automatically mean your knees are beyond help. Your body at 60, 70, or 80 plus can still adapt, grow stronger, and move better when given the right kind of movement. In this video, I'll first explain what's happening inside your knees in simple language. Then I'll guide you through a series of gentle, joint-friendly exercises you can do using only a chair and a bit of space. I'll keep everything slow, controlled, and appropriate for seniors, and I'll give you safety rules so you know how to respect your limits. This is general education, not personalized medical advice. If you have severe pain, major swelling, a recent surgery, or conditions like severe arthritis or joint replacement, please talk with your own doctor or physical therapist before starting anything new. You deserve care that fits your specific medical history. With that said, let's talk about what's really going on in those knees. Think of your knee as a hinge joint that connects your thigh bone, femur, to your shin bone, tibia. In between, you have cartilage, smooth cushioning on the bone ends that lets them glide without grinding, meniscus, extra pads of cartilage that act like shock absorbers, ligaments, strong bands that keep the joint stable and prevent it from wobbling too much, muscles and tendons, especially the quadriceps at the front of your thigh, the hamstrings at the back, and the glute muscles in your hips. When these parts work together, the knee bends and straightens smoothly, allowing you to stand, walk, sit, and climb. What aging does to the knee. As we get older, several things commonly happen. Cartilage wears down a bit, especially with years of use. Muscles weaken if we spend more time sitting and less time moving. Tendons and ligaments stiffen if they aren't taken through their full range of motion regularly. Extra body weight or ongoing inflammation can add more pressure to the joint. The result? You might feel stiffness when you first get up in the morning, pain when going downstairs or downhill, aching after standing or walking for a while, a sense that your knees are unstable or might give out. Why rest alone isn't the answer. When knees hurt, it's natural to avoid movement. Rest can help during a short flare-up, but too much long-term rest often makes things worse. Muscles around the knee become weaker, providing less support. Joints get stiffer and more painful when they aren't moved. Balance and coordination decline, raising the risk of falls. On the other hand, the right kind of exercise can strengthen the muscles that support your knees so the joint doesn't carry all the load. Lubricate the joint by moving fluid around the cartilage, reducing stiffness. Improve balance and control so you feel more secure when walking and turning. The key is gentle, low-impact, controlled movement. We're not talking about jumping or running. We're talking about small, deliberate exercises that respect your age, your joints, and your current condition. Pain guidelines to stay safe. As we go through the exercises, keep these rules in mind. Mild muscle effort or a light ache is okay. A sense of stretch or gentle work around the knee is normal. Sharp, stabbing, or worsening pain is your signal to stop or make the movement smaller. If you notice increased swelling later, that's a sign to do less next time and speak with your doctor if needed. You are always in charge. Move slowly, breathe, and treat your knees with kindness. Gentle, knee-friendly exercise routine for seniors. You don't need a gym, machines, or special gear. A stable chair, a bit of open floor, and comfortable clothes are enough. You can think of this as a simple routine you can do 2 to 3 times per week to begin, and adjust based on how you feel. Exercise 1. Seated march. Warm up your hips and knees. This is your warm-up to get blood flowing. Sit tall on a sturdy chair, feet flat on the floor, hands resting lightly on your thighs or the sides of the chair. Gently lift one knee a few inches off the floor, like a slow march. Lower it back down and lift the other knee. Continue alternating legs at a comfortable pace. Aim for 20-30 total marches. Move smoothly, not quickly. If you feel off balance, hold the chair firmly. What it does, this wakes up your hip flexors and thigh muscles, gently moves the knee joint, and prepares your body for the strengthening work ahead. Exercise 2. Seated knee extension. Strengthen the front of the thigh. Your quadriceps muscle in the front of the thigh is one of the most important protectors of the knee. Sit near the front edge of the chair with your back straight and hands holding the sides of the seat. Keep one foot flat on the floor. Slowly straighten the other leg so your knee extends and your foot lifts off the ground. Gently tighten the front of your thigh as you straighten. Hold for 2 to 3 seconds, then slowly lower your foot back down. Repeat 10-15 times on one leg, then switch sides. If this becomes easy, you can add a slightly longer hold or, later on, a light ankle weight, but only after checking with your doctor. Why it helps. Stronger quads reduce pressure on the knee joint when you stand, walk, and climb stairs. Exercise 3. Chair. Sit to stand. Build everyday strength. This exercise copies the action you use every day to get in and out of chairs, toilets, and car seats. Sit in a sturdy chair with your feet under your knees, about hip-width apart. Lean your chest slightly forward, keeping your back straight. Press your feet into the floor and push through your legs to stand up. Use your hands on the chair or your thighs if needed. Once standing, pause for a moment, stand tall, and breathe. Slowly lower yourself back down under control. Aim for 8-10 repetitions. If this is very difficult, start with fewer reps or use a slightly higher chair. If it's easy, try folding your arms across your chest for some repetitions, as long as you feel steady. Why it helps. Sit to stand strengthens the thighs, glutes, and core while training one of the most important movements for independence. Exercise 4. Standing heel. Raises, support ankles, knees, and balance. Your calf muscles and ankles help absorb impact and keep your steps controlled. Stand behind your chair and lightly hold the back for balance. Keep your feet hip-width apart. Slowly lift your heels off the ground so you rise up onto your toes. Hold for 2 to 3 seconds, then slowly lower your heels. Repeat 10 to 15 times. If balance is a challenge, keep both hands on the chair. If it becomes too easy, perform the movement more slowly to increase the effort. Why it helps. Stronger calves and more stable ankles improve walking and standing and reduce extra wobbling forces on the knees. Exercise 5. Standing mini squat. Gentle knee strengthener. We're not talking about deep gym squats, just a small, controlled bend. Stand behind the chair with feet about shoulder width apart, hands resting on the back of the chair. Slowly bend your knees a little, as if you are about to sit, keeping your chest open and your back neutral. Stop well before you feel significant discomfort. Hold the mini squat for 1 to 2 seconds, then press through your heels to stand back up. Aim for 8 to 12 repetitions. Keep your knees roughly in line with your toes, not falling inward. If you feel pain, make the movement smaller or skip this exercise and focus more on the seated ones. Why it helps. Mini squats build leg and hip strength in a way that looks very much like daily life. Bending to sit, lower to pick something up, or steadying yourself. Exercise. 6. Side leg raise. Strengthen hip support. When hip muscles are weak, the knees can collapse inward during walking, which stresses the joint. Stand next to the chair, one hand lightly holding the back. Keep your body tall and your feet together or hip width apart. Slowly lift the leg farthest from the chair out to the side a few inches. Keep your toes pointing slightly forward, not up toward the ceiling. Avoid leaning your upper body. Let the leg do the work. Hold for 1-2 seconds, then lower slowly. Repeat 10-12 times, then turn around and do the other leg. If needed, keep the movement small. Safe control is more important than height. Why it helps. This targets the muscles on the side of your hips, which help keep your pelvis level and your knees better aligned when you walk. Exercise 7. Hamstring stretch. Ease. Tightness behind the knee. A gentle stretch for the back of the thigh can help your knee move more freely. Sit on the edge of your chair. Straighten one leg in front of you, heel on the floor, toes pointing up. Sit tall, then gently lean forward from the hips, keeping your back straight, until you feel a mild stretch behind the knee and along the back of your thigh. Hold the stretch for 15-20 seconds, breathing calmly. Slowly back off and switch legs. Repeat 2 to 3 times per side. You should feel a comfortable stretch, not sharp pain. Why it helps. Looser, more flexible hamstrings reduce pull on the knee and make it easier to straighten and bend comfortably. Putting it all together, a simple routine. Here's one way to organize these exercises. Warm-up seated march, 20-30 marches, strength and control. Seated knee extension, 10-15 reps each leg. Chair, sit to stand, 8-10 reps. Standing heel raises, 10-15 reps. Standing mini squats, 8-12 reps, if comfortable. Side leg raises, 10-12 reps each leg. Cool down. Hamstring stretch, 2 to 3 times per leg, 15 to 20 seconds each. Start with one full round of this routine 2 to 3 times per week. If you feel okay the next day, a bit of normal muscle soreness, but no big flare of joint pain, you're likely at a good level. Over time, if your body allows, you can add a second round of some exercises. Always listen to your own knees. Some days you might do the full routine. Other days you might pick just 3 or 4 exercises. That's perfectly fine. Knee pain can make your world feel smaller. Maybe you've stopped walking with a friend because you don't trust your joints. Maybe stairs make you anxious. Maybe you're quietly afraid of losing your independence. I want you to know, even if you've had pain for years, your body can still respond to consistent, gentle effort. You don't have to become an athlete. You just have to show up for yourself in small ways, again and again. Every time you lift a leg during a seated march, every sit to stand you complete, every careful stretch you hold, you are sending your knees and your brain a powerful message. I'm still here, I'm still working, I'm still taking care of myself. Progress may not be dramatic from one day to the next, but over weeks and months, these small efforts can add up to less stiffness, more strength, and more confidence when you move. Be patient and kind with yourself. You've earned that. If this routine felt helpful, or even if it simply gave you hope and a clear place to start, make a decision right now to practice it regularly. You can save this video, return to it a few times a week, and let it guide you. And if you have a partner, friend, or family member who also struggles with knee pain, share this with them so they don't feel alone and helpless. For more videos focused on joint health, balance, strength, and independence for seniors, you can follow Senior Health Secrets so you always have practical, age-appropriate tools to care for your body. I'm Dr. David Kaplowitz, MD, and this is Senior Health Secret, where we believe that getting older should mean gaining wisdom and keeping as much strength and independence as possible. Thank you for spending this time investing in your health today. Take a deep breath, feel your feet on the floor, and give yourself credit for taking a step toward happier knees. Stay safe, stay steady, and I'll see you in the next video.